Do you feel that your lips are or have become thinner and it's affecting your confidence and your attractiveness? I'm Dr. Owen Thomas, a fellowship qualified aesthetic doctor in London, UK. Stick to the end and I'm going to tell you all about my evidence-based approach on how to trim thin lips to get a great, beautiful and natural result. So I'm going to look at lip aging and why lips become thin in the first place and how I treat that to get a great result. I'm focusing mainly on females in the talk, but I'm also going to mention men. The problem still affects males. So what are thin lips? So there's no exact definition. It's a perception that we have as humans. We measure proportions within the human face with beauty and attractiveness, and studies show that we can do this in a couple of milliseconds. Particularly in profile view, smaller lips, which are in turn can make the nose or the chin look bigger, and in medical aesthetics we use ratios with certain lines to be able to measure how far forward the lips should be. From the forward-facing view, it's important that lips have enough height to be able to show the cupid's bow. The exact ratio of the lips between the upper and the lower will depend on a number of factors, including choice and also ethnicity, with Caucasians tending to have a narrower upper lip compared to the bottom lip, whereas Afro-Caribbean ladies would have a equal upper and lower lip. So narrow lips can be either primary or secondary. Primary is the genetic familial makeup that we all have within our cells, whereas secondary are things that occur to us through life. If you already have genetically thin lips, of course, secondary factors can make that worse by amplifying it. So secondary changes are, of course, aging, but also factors such as poor health, disease, dentition, UV exposure, and smoking. UV exposure particularly breaks down collagen, and I'll talk about that in a minute. And smoking also has very detrimental effects on skin health as a whole, and also the pursing of holding a cigarette in the lips tends to scrunch the muscle up and causes the vertical lip lines to accelerate, particularly in females. So within the face as we age, we have lots of loss of fat in different areas and even increase in fat in some superficial compartments. In the lips, we lose some of that fatty tissue, leading to the lips becoming generally deflated. Underneath the lips, we have loss, particularly in the marionette area, causing marionette lines to form. So the muscle around the lip, called orbicularis oris, tends to lose in strength and definition becomes weaker. That muscle inserts around the mouth and you can feel it if you purse your lips. As the muscle becomes weaker, we lose definition within the edge of the lip. The lip skin itself becomes thinner and more prone to dehydration, and that also accentuates the loss of definition of the vermilion border. So over time we also have repetitive movements and microtrauma. All of the speaking and blowing or sucking through a straw over many years causes breakdown of collagen. We also have dentition changes, loss of teeth, and the bone structure around that tends to lose the support underneath the lips, which allows it to project forward. So why should you treat thin lips? Well, there's no medical need to treat them. It's an aesthetic one, and therefore it's a personal choice, and not everyone will desire to have treatment. However, we know from lots of studies that aesthetic treatments and non-surgical treatments are really successful in improving people's self-perception and image of their own attractiveness, and this allows them to be more confident. And if they're more confident, then they can engage socially more readily with others. Most sensible people will understand, as do medical injectors, that we can't turn the clock back 20 or 30 years, but we can move the needle slightly towards attractiveness and beauty, and small changes can make people feel a huge amount better. So as well as lots of different studies showing improvements in confidence with non-surgical techniques, there are some studies which specifically demonstrate this with lip augmentation with dermal fillers. Studies in lip augmentation consistently show about a 90% or greater satisfaction rating. A study by Bertucci and colleagues looked at a cohort of ladies treated with dermal fillers in the lips, and this showed that they were highly satisfied with the look, appearance, natural feel and kissability of the lips. And this also looked at the opinion of the partners, who were also particularly pleased and impressed with the results. So there was one particular study looking at the effects of augmenting thin and thick lips. This was a study by Hernandez and colleagues, and it looked at a group of patients with thin lips and a group of patients with thicker lips who both underwent dermal filler augmentation. So in this Hernandez study, the groups of patients who had the lip augmentation were judged on their own self-perception, but also objective before and after photographs, which were looked at by a standardized panel of medical injector experts. So the results of the study were interesting in that the group who had thicker lips were actually perceived to be no more attractive and even slightly less attractive after the lip augmentation. The group who had thinner lips to begin with, however, had a very significant statistical improvement, not only from the expert assessors looking at the before and after photos, but from the self-perception of the patients themselves. So what are the treatment options for thinner lips? So firstly, there's always the importance of preventing further deterioration, and this means using SPF lotion or lipstick, stopping smoking, eating healthily and exercising. That's going to improve blood perfusion to the lips, and all of these things are crucial. Facial exercises are quite in vogue at the moment, and I think that's because people want to seek a natural alternative to medical, non-surgical or surgical techniques. Facial exercises have been shown in small studies to actually improve facial attractiveness and facial volume. This hasn't been replicated in larger studies, but there are some encouraging pieces of evidence. There's nothing specific for the lips, and it's something which is obviously not going to do any harm other than the time taken. And I think that's the problem with facial exercises, in that it requires a lot of effort and compliance. And perhaps the small studies that we have are a more highly motivated cohort of patients who might be motivated to do the exercises regularly. But it still is a treatment option that might need to be explored. That's really going to help muscle strength, the orbicularis around the mouth, which might help definition, but unfortunately it's not going to help all of the causes of aging, such as the fat and volume loss. So another option is a botulinum toxin lip flip, and that means injecting botulinum toxin in a few points, mainly in the upper lip, and that is just above the muscle. So the premise of the treatment is that it's weakening the orbicularis muscle, which inserts into the lips, so it pings open slightly. It's got a curve as it inserts into the lip, and as it everts the lip, you can see more of the red lip, and therefore the lips look a little fuller. So it's quite effective in doing this. It's a modest improvement. The downside is because it's actually weakening the orbicularis muscle, you can have functional loss. So people often can't suck through a straw, they can't blow a musical instrument, and in the worst cases they can have problems forming certain consonants when they're speaking, which can be a little embarrassing. Those effects only last for a few weeks, but as you might imagine, if the after effects or the side effects are only lasting a few weeks, the beneficial effects probably aren't going to last much longer. So most people I speak to after discussion of the risks and benefits don't opt for that, but it is something that some people do find beneficial. Moving forward to surgical treatments, that's an option when people have got significantly advanced changes, and there are procedures where you can make incision and remove tissue. Therefore, the elongation of the upper lip can be reversed, giving the lip a little bit more shortening and a three-dimensional structure. So that can be really effective as a surgical treatment, balanced against the risks that surgery brings with it of scarring, infection, and other risks that can't be easily reversed. So by far the biggest treatment is lip augmentation with dermal fillers. So dermal fillers are substances that fill volume, and almost all of the ones that are used in the lip are made from a substance called hyaluronic acid. So hyaluronic acid is a substance that's naturally found in the skin, and the more that you have in the skin, generally speaking, the brighter the skin looks because it hangs onto water. So this natural substance is converted in the labs into long chains by using cross-linking, and that forms a gel of different consistencies. In the lips, we usually use a soft to medium, sometimes a slightly firmer filler, depending on the results that you want and the anatomy of the lips themselves. So we don't tend to use other fillers in the lips for various reasons. Certainly permanent or even semi-permanent fillers are discouraged. In the past, silicone was used, but if it went wrong, it could have horrendous complications or outcomes. Sculptra or Radiesse wouldn't be used in the lips. Hyaluronic acid fillers are really the go-to product when you're doing lip augmentation. So you should always have the treatment done with a medical injector. In certain countries, that's a necessity anyway. In the UK, we are still having unlicensed, unregulated people doing the treatments, and I've seen some horrendous complications, bruising and vascular occlusion, which are best avoided. So please always go to a medical practitioner. So done properly and carefully, lip injections are safe. We know where the anatomy is. It's also got a ring circulation, so serious vascular occlusions are much less likely with the lips anyway. It's all about depth and planning and doing the lip treatments naturally. To enhance this, I also now use an ultrasound scan so I can map out the vessels in the lips before treatment, and I can use the ultrasound to dissolve filler where that isn't cosmetically ideal. By knowing where the vessels are before we do the treatment, it can sometimes alter the treatment plan. For example, if we see that the vessels are very superficial, we might reduce the amount of superficial injections that we do and use a cannula instead. So with dermal filler lip treatments, the aim is to restore and rejuvenate the lips and also the perioral area, that's the tissue around the mouth. There are two main ways you can treat lips. You can do it with a cannula or a needle. A cannula is a small tube about 4 centimeters long that inserts through the side of the lip, so there's very few injections in the actual lip themselves, whereas needle is actually introducing the needle into the lip itself. So there are disadvantages and advantages of both. Needles are used where you need more precision and you're trying to invert or change the shape of the lip, whereas cannulas are very good for a low trauma, natural result when you're volumizing the lip. So I've modified my lip technique over the year, and for most patients with thinner lips, I will use a cannula from the side to volumize the lip, and then small tiny needles going vertically down from the edge of the lip near the vermilion border, and the aim of that is to gradually and gently rotate the lip outwards. And we know that we can't always do this in one session. In fact, you can very rarely do it in one session with someone with very thin lips, but we can build it up gradually. There was a great study in 2021 in Greece by Keramidas and colleagues, which looked at a cohort of patients, mainly female, who were treated at the lip clinic. They all had naturally thin lips, and it showed that sequential treatments over a period of 12 to 18 months with no more than 1 syringe at a time led to a very significant increase in lip height, and all of the patients 100% satisfaction at the end of the study. So I now use a cannula approach from the side for most patients with thin lips. This reduces the chance of bruising or vascular occlusion and gives a really natural result. I often use a semi-stiff filler, a slightly firmer filler than in most lip treatments, around the edge to try and rotate this upwards, and that's coupled with vertical threads of filler in the central portion of the lip, and that's to increase the cupid's bow. The vertical threads, as well as rotating the lip, they also slightly fill the vermilion border, which is a tube in the edge of the lip, and that gives it more definition. This is also combined with treatment around the lip in patients who are more mature, and that's replenishing some of the volume lost in the marionette area and the area above the lip where you can get vertical lip lines. We very rarely individually treat lip lines now, but paint tiny threads of filler around that to soften the lines themselves. As I mentioned earlier in the video, males also have problems with lips becoming narrow with age, and that can have an aging look. And whilst it's thought of as less of an issue for men, it can still be aesthetically less pleasing. So often do lip volumization on men. Some would want feminization, but in most men who don't want it to be feminized, we treat more along the whole length of the lip. Often the central part of the lip still has slightly more volume in men, but there's less height in the middle part of the lip, and we don't accentuate the cupid's bow itself. For patients who've got skin changes around the mouth, like vertical lip lines that are deeper and not fully amenable to fillers, then there are other device treatments like laser or my favorite, Morphisate. I've got a video on Morphisate, so you can check that out here. If you enjoyed the video and you'd like to find out more, why not hit subscribe below, and I'll see you in the next one.